So this session was a very important session because it deals with a contemporary concern that we have, because as we are allowed in Europe to treat slightly younger patients than what we did in the past, comes the issue of the lifetime management of these patients and the choice of the first therapy, whether it be surgery or TAVI, has consequences. And all this session was about discussing the pros and cons of the various options, integrating the will of the patient, the background of the patient, and what we anticipate is going to be the future outcomes for these patients. This is a quite important topic, because we know that in intermediate risk patients, TAVI has similar outcomes to surgery. But when we put into the equation the issue of the renal function, this has also an impact on the final valve choice, because patients with renal failure are going to have a device, if it's, for instance, a surgical valve that is going to degenerate faster, it may be the same for TAVI. So we need to integrate that with the life expectancy of this particular patient. It may be an intermediate risk, but the degree of renal disease, if the patient is on dialysis and so on, has an impact on the anticipated durability of the platform that is going to be utilized. For the time being, potentially in intermediate risk patients, if we have peripheral vascular disease that may preclude a safe advancement of the delivery catheter for TAVI, surgery could be an option. Otherwise, TAVI in general, I guess, for this particular subgroup of patients, is logic, makes sense. So in intermediate risk patients, we know that the outcomes, this is given, proven by the literature, are similar. Transfemoral TAVI and surgery in intermediate risk patients bear the same outcomes. So it's going to have to deal with the anatomy of the patient. If we have a suitable transfemoral anatomy, we know that we can safely treat these patients with TAVI. If we have more challenging anatomies, like for instance bicuspid aortic valves, ascending aorta aneurysms, small aortic roots, a bit challenging peripheral vasculature, potentially surgery has advantages as compared to TAVI.